Welcome to The Hidden Load, the podcast where we uncover the unseen weight carried by the educators and leaders in medicine and explore how to lighten it. I am Dr. Santina or Tina Wheat. I am a family physician, an educator, a leader, and a coach. Each week, we will dig into the challenges that often go unspoken, from burnout and boundaries to purpose and identity to figuring out sustainability, and share practical tools to help you move from chaos to calm and from burnout to balance. Because the hidden load does not have to be yours to carry alone, and in fact, shouldn't be. Let's get started. Welcome back to The Hidden Load, the podcast for the educators and leaders in medicine. I am your host, Dr. Santina Wheat, and I am so glad that you are here. And welcome to episode number 9, Moral Injury versus Burnout. In our last episode, we spoke all about advocacy, how once we connect with our purpose, the next step is using our purpose to create change. And I shared how advocacy is not extra, it's actually part of the work. And today, we are going to talk about a topic that gets brought up a lot in healthcare, but it gets brought up without enough clarity. And that is a difference between moral injury and burnout. People often use these terms interchangeably, but they're just not the same. And if we treat them as if they are the same, then we end up missing the real source of the problem. Even worse, we risk putting the responsibility back onto the individuals when we really need to be talking about the problems of the system. So let's slow down, define these concepts together, and then talk about what they mean for us as professionals in medicine, especially for those of us who are leaders and educators. First, let's actually look at burnout and define it. The World Health Organization recognizes burnout as an occupational phenomenon, not a medical condition. It shows up with 3 hallmark features. There is emotional exhaustion, that drained, I have absolutely nothing left feeling. The second feature is depersonalization or cynicism. That is the sense of starting to detach or even becoming numb towards your patients or your colleagues. And then the third part is a reduced sense of personal accomplishment. It's the feeling like you're just not making a difference, or you're never going to make a difference, no matter how hard you try. If you have ever left a clinic shift or a teaching day thinking, I am completely spent, I don't even have the energy to care right now, well, that might be burnout. And let's be honest, it makes sense. Burnout happens when the demands outpace the resources and when they outpace them over and over and over again. And that's something that happens in medicine. It might be too many patients or too much documentation or too many expectations and not enough time, support, or recovery. And let's be honest, in medicine, all of those things all together. And as educators, we also see burnout in our learners. We have residents who are working long hours, who have busy weeks, or students who feel like they're running on fumes and just never measuring up. And as an educator, it's harder to teach someone that feels that way. Burnout is about depletion, where the tank is empty. And so whether it is you're experiencing burnout or your teammate or your learner, it impacts all of us. So let's now move on to moral injury, because that's a little bit different. Now, this concept, it came from military psychology. Soldiers would describe the lasting harm that they felt when they were forced to act or when they were prevented from acting in ways that violated their core moral beliefs. That sounds familiar, right? In healthcare, moral injury happens when we know what our patients need, but the system puts barriers in the way. That might be an insurance denial for something that is standard of care. That might be productivity metrics that force us to cut our visits short and leave our patients feeling like they haven't gotten the care that they needed. It might be bad decision by leadership where they prioritize finances over people, either their employees or their patients. Or it might be being asked to teach or evaluate in ways that conflict with our values as educators or leaders. As an important distinction, moral injury is not about being tired. It's about being forced into situations where your values and your actions cannot line up. It's about being forced into these situations that feel like a betrayal. It's a betrayal of your patients, your calling, and sometimes of yourself and your core. So you might be wondering, well, why is it important to name the difference? Well, it's because when we blur the lines, we try to apply the wrong solutions. If we call absolutely everything burnout, the fixes we reach for are individual, and this is why we get frustrated. Go take a mindfulness class. Go get more sleep. Take the time to practice gratitude and build resilience. Now, don't get me wrong. You have probably heard or will hear me say each of those things because each of those things are helpful. I am a huge advocate for recovery practices. But the problem is they do nothing to address the problem of moral injury. Because moral injury is not about resilience. It is not about whether you can bounce back. It is about the system forcing you into an ethical corner. You can be the most resilient person in the world and still feel crushed when you can't get your patient the care that they need. That's not a problem that can be fixed with meditation. That's a problem that truly needs a system fix. This is where leadership matters. If we don't distinguish between burnout and moral injury, we unintentionally gaslight people into thinking that they are weak, when in fact, they are bumping up against broken systems. Now, also, don't get me wrong. There can be a cycle of the two things where they bump up against each other. If you are feeling burnout and you experience moral injury, it might hit you so much harder than that person who is not experiencing burnout when they face moral injury. And when you have the 1,000 little paper cuts of the things that are adding to moral injury, that can contribute to your burnout. So it can be circular. But when someone is facing a problem, it's really important to name it. It's really important to know what we need to fix. So let's talk about personal stories, ones that I'm sure you can relate to. I had a patient who needed a very basic test, something that any clinician would agree was indicated. But the insurance company kept denying it, insisting that extra steps were necessary, and of course, that delayed care and added to the cost. I knew that the delay could harm this patient, and I remember the frustration that rose in my chest because I had the knowledge, I had the skills, and yet my hands were tied by a policy that I had nothing to do with and that didn't follow good medicine. And at that point in time, I wasn't burnt out. I wasn't too tired to think. I was fully awake and fully aware. And I felt violated because the system was preventing me from doing what I knew was right. That is moral injury. And I'll be honest, those moments stick with me much longer than a tiring day. They don't just drain energy, they also erode meaning. And when you feel like there is no meaning, when you feel like you can't accomplish the things that you want to do, let's not forget that's one of those signs that leads into burnout. But here is the reframe that I want us to hold on to. Burnout is about depletion. Moral injury is about violation. Burnout says, I'm too empty to keep going. Moral injury says, I'm not allowed to live my core values in this role. Both of those problems are extremely painful, and they both deserve attention. But they require different responses. And as leaders and as educators, we need to model that difference for our teams and for our learners. Because if they see us labeling every system failure as burnout, then they will internalize that the problem is them. Their stamina, their toughness, their resilience, all isn't good enough. Instead, let's be clear. Burnout means it's time to protect your energy and build your recovery. Moral injury means it's time to name the conflict, to advocate, and to push for systemic change. This is why we hear people frustrated about one more pizza party or one more mindfulness session that is not willing to address the root of the problem. It's important to name what it is we are trying to address. It's not going to fix it overnight, but naming it correctly is the first step towards healing. And so here is my invitation for you this week. I want you to reflect on a recent challenge. And I want you to ask yourself the hard question. Was I burned out? Or was I morally injured? Now, if it was burnout, what can you do to recover and rebalance? Do you need to go back and listen to my episode on recovery? Do you need to go back and listen to my episode on balance or boundaries? Those are strategies that can help you with burnout. If it was moral injury, then what might advocacy or systemic change look like, even in a small way? Can you go back and listen to episode 8 about advocacy or episode 4 about self-advocacy and see if you can make a meaningful difference, even in a small way? Ultimately, it's important to remember that both matter. Both burnout and moral injury are real. And you deserve support, whether you're facing one, the other, or both. And you deserve the tools to be able to help you make the change to prevent both of them in your system. Thank you so much for joining me today on The Hidden Load. In our next episode, we will be exploring identity. We're going to talk about how we show up in healthcare, and we're going to talk about how we show up in medicine, how we balance our personal and professional selves, and why keeping these identities too separate can actually increase the hidden load. Thanks for joining me on The Hidden Load. Tag me on Instagram at Dr. Tina Wheat or email me at santina@santinawheat.com with your takeaways and ideas. Don't forget to subscribe, and until next time, let's lighten your hidden load.